احنا كده بالتالي بنبدأ النص التاني او معنى صح التلت الاخير من المؤتمر. والتلت الاخير ده symposium kindly presented to us by Velmeni AI Solutions. This is a US company based in Florida, with their main interest is AI in dentistry. This is where the important comes from, because our conference is about AI in healthcare, and dentistry is still healthcare, and it's an important part of healthcare. And we're happy to have Velmeni, represented by their CEO, Ms. Mini Suri, join us for this conference virtually. And I will leave the stage for Ms. Mini to present her team and brief us on what we're going to be seeing over the next 30 minutes. It's going to be 25 minutes for the virtual presentation, and we have a 5-minute Q&A at the end. Ms. Mini, I know you're online with us, and we can see you, and Rohan is also there, so stage is yours. Great to see you here. Thank you.
Thank you, Dr. Ahmed, everyone, for having us. It's a great pleasure to be part of this great conference. Apologies we could not be there in person. I'm Mini Suri, CEO of Velmeni. By the way, Velmeni means a robot in Icelandic. AI is for automation. So I am, basically, I'm not a dentist in full disclosure, but I sincerely believe oral health is the gateway to general health. And now more and more research is coming where oral health is linked to systemic health. And it's very important that for us, the mission is 1 billion people. If we can improve their oral health, we can also improve their general health. I'm not going to take much time because I have my partner here, Dr. Rohan Jagtap, who has been part of Velmeni from past 1 year or over 1 year. He is our chief radiologist and researcher. So not only that we built AI solutions, as Dr. Ahmed mentioned, but we are deep into research. We partner with a lot of universities around the world, whether it's US universities, in Japan, Cairo, all over. We are into very deep research with our AI. And Dr. Rohan Jagtap, who's here with me, is the one who's heading that. So if anything, anybody or any university is interested, please do contact us. Dr. Ahmed will have our contact information. So with that, Dr. Jagtap, please take over. And I'm going to put myself on mute here. Thank you, everyone, for having us. Over to you, Rohan.
Can everybody hear me well? Am I audible? Yes. Yeah, first of all, thank you for inviting us to this exceptional conference, and very delighted to present this topic of artificial intelligence in dentistry. As Mini said, I'm a chief radiologist and researcher at Velmeni AI. So I'm also director and assistant professor at the University of Mississippi Medical Center in Jackson, Mississippi. I was a past chair of American Dental Education Association Radiology Section and a current president-elect for IDR Diagnostic Group. Let me start my presentation real quick. As Mini said, we are from Velmeni, so it's a pioneering AI-driven dental care. We focus on more of a automatic detection of radiographs. We are heading towards more of a if the photograph is uploaded in the system, how AI would be able to diagnose the dental issues in any patients. So basically, what Velmeni can do is predictive AI and automatic detection started as a passion for automation. And as Mini said, Velmeni is the scientific term for robot, and our heart is totally based, more focused on helping more and more patients. And as oral care has a huge impact on general health, so our vision is to create that AI model to make people's life better and inspire. That inspires our work. major problem in the industry is 30% of the can you hear me?
Rohan, I think the presentation is not being shared, Rohan. Your presentation.
I did. Can you see it?
I can see now. Can everybody see it? Technical team, can you confirm? Okay, got it. Okay, go ahead.
Good. Do you want me to go back
Yes,
or?
yes, Rohan. Yeah, Rohan, now continue. That's
Yeah.
fine.
Okay. So major industry problem in dental field is more of a 30% of diagnoses are missed. Couple of reasons for that is that inconsistent treatment plan. So if you get, for example, 5 or 10 dentists in a row and give them a radiograph, there is a less chance that they would agree with each other and have that calibration in even diagnosing even small as a caries or periodontal bone loss. So what our aim is to create that consistency in AI, that there is no bias, and our aim is to create that model. So we were very successful in a 2D, and we are really working hard in a 3D aspect. Other thing is a poor patient experience. Because healthcare in dental is and also in medical heavily rely on human assistance, so it's a slow moving process. So our aim to use artificial intelligence to have that patient experience improved significantly. And then other thing is adherence to the plan. So most of the visits after a particular dental treatment gets lapsed in the system. So our adherence plan allow a lot of practitioners to have that follow up, and also patient have that follow up for frequent visit and make sure that they are getting the dental care they need. So these are the major focuses right now. Other benefits would be about billing. We are trying to see that if once the Velmeni AI product is launched, then billing will be something we will take care of. When patient walks in, they don't have to worry about their insurance, and the practitioner doesn't have to see how much is out of pocket. So everything will be taken care by Velmeni AI. Um, to go more deeper into artificial intelligence, American Dental Association, which is a national body which looks over all the dental practices and field of dentistry in the United States, they came up with the two terms. One was artificial intelligence and one was augmented intelligence. Artificial intelligence, the major difference is that in AI, artificial intelligence, machines are demonstrate the intelligence and opposed to the natural intelligence displayed by humans. But in augmented intelligence, basically the machine is helping. It's assist is a, act as a tool to assist human to the clinicians to perform specific tasks. So one aspect is American Medical Association House of Delegates defined the term, emphasizing that augmented intelligence is it designed to enhance human intelligence than replacing it. So they were more inclined to using augmented intelligence into the white paper by American Dental Association. To talk about my specialty, oral and maxillofacial radiology, it's a ninth ADA recognized specialty which focuses on production and interpretation of images and data, which is produced by radiant energy, and what those images are used for. It is for the diagnosis and management of diseases, disorders, and condition of oral and maxillofacial regions. So that is a specialty I belong to. How this specialty plays a central role in the whole all the specialties and also in AI is because, as you can see on the screen, that my oral maxillofacial radiology is kind of in the center, and it is helping with the diagnosis of all the oral and maxillofacial pathologies. Oral surgeon use it for their surgeries, for even for 3D printing they use it. Endodontic before endodontic practices used to be focused only on the 2D images. Now Endo has changed their view to use more of a cone beam CTs, and American Association of Endodontists and American Association for Oral and Maxillofacial Radiology came up with the position paper of use of more cone beam CT in their practices and the guidelines. So you will see significant increase by endodontists to use cone beam CTs. Orthodontists are using for their, as you are all medical radiologists, but if you might have heard about braces, So if the orthodontists are very heavily relying on the um, cephalometric 2D imaging, but now they are using cone beam CT, and AI is helping to have that tracing done. And I'll talk a little bit more about it in next slides. Implant dentistry, which is very crucial part. You might have heard about implant placement in jaws. So tracing that mandibular canal is very crucial, and also use of cone beam CT has been very helpful. And general dentistry always 2D imaging for caries detection, periodontal bone loss, if there is any periapical pathology, impacted teeth, everything comes under general dentistry. So there is a lot of overlap of my specialty with other all other specialty, but it is really driving a force into the of AI into other fields of dentistry as well. So what is AI? It's in 1950, John McCarthy first coined this term, artificial intelligence, when it's referred to the machines capable of doing human tasks through learning and adaptation of external data. As we all know, in day-to-day practice, you might have heard about Siri, Alexa, any other device which do recognize speech. They also make the decision. Some other software will help us to solve problems, playing games, and even translating languages. AI is playing role into day-to-day our practices. So if we need any help, we try to use AI. But in clinical medicine, more focus is on prediction of disease risk, diagnosis of pathology, abnormalities, also treatment planning and potential prognosis of the disease. These are some of the major areas of AI in our healthcare. How does AI work? Basically, the first step is to get the data. It's a very raw data. Then with that data, we try to clean, prepare, and manipulate that data. What does it mean is that we get rid of any artifact, we get rid of any issue with that imaging, which the machine or radiologist cannot, or any clinician cannot read. Once that data is clean and prepared, we try to train that model based on that well organized data. Once the model is trained, the next is testing. So basically, if you take 100 CT scan, 80 of them we try to train the model. 10 is for more of a validation, and 10 is for testing. So we do the testing with those 10 or 10% of those CT scan or any 2D imaging, and then once the results is about 90% or 95%, then only we use that data as our algorithm. If it is not that, we try to improve it and go back to the same first step. So this is how the cycle runs all over again and again until we reach that accuracy that we can use the AI for our patient. There are two subfields of AI, machine learning and deep learning. 1959, Arthur Samuel coined the term machine learning. So the AI technologies are driven by algorithms. So these are algorithms is basically the set of instruction that guide a computer action. So most widely used algorithms are decision tree, neural networks, and deep algorithm. Decision trees are employed for decision making. Neural networks are for pattern recognition. Deep learning is mainly to perform a task about image and speech recognition. So more and more as information coming and more work we are doing in algorithm, deep learning algorithm is the one which helping us a lot. So major difference between natural intelligence, then the CBCT reading software, or you can consider medical CT reading software, and actual AI. So this is a chart which actually explains it. So in natural intelligence is basically you have a perception, and based on our knowledge, we do the interpretation, and that's our response. In the softwares which we use to read the CBCTs, the more that's called as expert system, and then more data and rules are applied to it. There is a programming to that software, and then we can do the interpretation with the help of human agents. But in AI, there are, as I said, two subsets: machine learning and deep learning. In machine learning, there is more important is there are engineered features, but in deep learning, there is data and outcomes, plus there is feature learning and mapping. So in machine learning, we try to teach machine how to recognize these patterns, and it is by the mapping system. But in deep learning, it do additional thing that it learns automatically over the period of time. So it's not just one time thing. More and more data you would add to the system, it would learn automatically. So that's the major difference, and it gives the interpretation more accurate than humans. As I said, machine learning is a subset of AI. It enables computer to learn from data and improve their performance over time. Other major difference in machine learning, deep learning is amount of data. So large amount of data is used in the deep learning, and it is used to more of a recognize the intrinsic patterns and learn to perform more of a complex task. Usually, deep learning uses artificial neural network, which is inspired by the same function as the human brain. So again, the major difference is large amount of data. There are more neural networks. There is more complex tasks can be done by deep learning in compared to machine learning. In deep learning, as I said, more complex data structures are involved. If you consider a simple neural network, there are only few layers of neurons, whereas neural network that has many layers, it's considered under the deep learning neural networks. I might be going a little fast considering the time constraint, but I want to catch up with some of the basic fundamentals of artificial intelligence. So basically, deep learning by combining artificial neurons and interconnecting layers, as you can see here at input layer, hidden layer, and output layer. So this multi-layer artificial neural network helps to image classification when we upload an image to the system. So the term deep learning is refers to as a number of hidden network layers used to progressively extract that information and features of the input data. So as you can see, that multi interconnected networks have shown on this slide, and this will be at the end output of the after filtering out the information. So in deep learning, large amount of data sets is required. Multi-layer neural networks are there. You need a statistics and mathematics as well, but at the plus we need a computing power to have that storage of data plus processing that data. And at the end is a self-learning tool where it really reveals the important information of using that previous data and improving the results based on the new data added. So these are the 5 major elements of deep learning. What are the neural networks? Is basically represent the human neurons as artificial neurons, but just in a mathematical way, computerized nonlinear model. They are trained to use large amount of data and represent the intrinsic statistical pattern of the provided data. So basically, when you're training an algorithm, we are adding a data, we are training that neural networks, but at the end product, it should be able to recognize any other provided data from any other source. So it can be done through training, repeated exposure to the data points, labels, and numeric results. And then at the end, it would be able to predict the imaginary or linguistic data. For example, in dentistry, once we do the image classification and neural networks is engineered, does a radiographic image can classify as a caries or periodontal bone loss? Yes or no? So that could be a start of the analysis. So this image shows that how the human neurons are, and then specifically mathematically trained algorithm would be similarly reflecting dendrites. There is a nucleus and axon. So basically, it just imitates the biological neural networks and does the similar job as a human brain. Some of the algorithms we used in our when we are training algorithms are AlexNet, ResNet, UNet, and Google Net. Any research you come across in AI will have either of these algorithms mostly used in creating those algorithms for the image detection. Again, major important aspect of whole artificial intelligence algorithm system, especially deep learning, is about classification, segmentation, object detection, pinpoint. So basically, you can see an image of a cat. The next step is classification localization. So once you see that red box, so it does doing a classification that it's a cat, and it localizing it's focusing on only on cat face. Then, in case of object detection, we try to confuse the image with like cat and other dogs. So AI should be able to recognize that exactly cat features which we already provided in data, and it should be able to the object detection. Then comes the segmentation. So the box is not completely having a border of the only cat. So you can see that segmentation tool we border the cat and a dog and separate them out and only focuses on cat. And pinpointing is basically you're focusing on only one certain point on that cat, so we can actually come up with the final diagnosis. So these are the major step in any AI training algorithm. In case of success evaluation, some of you might have known about statistical analysis. So we more of focus on sensitivity, specificity, true negative, true positive, false negative. We also focus on intersection over the union, which is widely used evaluation metrics in object detection and image segmentation tasks. Python is the most important language which used for training these algorithms. And if you have any friends and family who wants to go for engineering, I would recommend learning this language, which is really changing the world. Some of the machine learning libraries we use is over here: TensorFlow, PyTorch, and every company uses it differently. So these are some of the machine learning libraries available online. As this conference is mainly focuses on medical radiology, but just like medical radiology become an important channel to incorporate this AI in the field of medicine, radiology, oral maxillofacial radiology produces those coded images as well, which are digital images, and AI is helping to translate these images into the computer language. So technology has grown fast in dentistry as well, especially with the use of cone beam CT. You all aware of the computer tomography, medical CT, but cone beam CT is kind of smaller version of that CT, and also the radiation is almost 10 times less than medical CT. And it became a very good tool for diagnosis and treatment planning of hard tissue structures. So it really changed how we do dentistry nowadays. Let's talk about combination of imaging and AI. In 3D imaging, CBCT market in the United States, as per 2017 data, is that there was annual growth rate of 10.8% through 2019. 2014-2015 report estimated that there were 5,500 CBCTs currently in the United States, with annually 300,000 pediatric and almost 400,000 adult CBCT being performed. And this is the data from 2014-15. So when they publish the 2025, 2024, and 25 data, these numbers will be shooting up significantly. Previously, only 48% were general practices using this exam, and then 44% oral surgery. But now, considering ortho, endo, and other specialty using it, there is a significant increase in use of cone beam CT in the practices now. This slide shows about how the research in the 2D imaging and 3D imaging has changed. So, for example, from November 1992 until 2019, the column at the bottom shows that only 2D imaging being used in the research. But since you can see from 2011, 2015, there is an increase in cone beam CT as well. 3D imaging has been used in research a lot. So almost by 2023 or 24, as you can currently, you can see surpassing use of 3D imaging compared to 2D imaging. So that's what we focus at Velmeni as well. Now let's talk about most important aspect, that AI application in different fields of dentistry. These are some of the recognized specialty in dentistry in the United States. Let's talk about oral maxillofacial radiology and pathology. Most of the time, general dentists are unable to accurately segment and interpret maxillofacial pathologies. There is always a limitation based on the education and clinical experience. So radiologists were helping to solve these cases are complicated, but there are not many radiologists out there. So AI would be a great tool to help in diagnosis and treatment planning. Uh, and many research studies have been conducted to see if AI software can actually able to identify this. We usually start, for example, we start with teeth segmentation. But as more and more we go and train the algorithms, it more focuses on pathologies like cystic lesion, tumors, TMJ, sinus problem. So here you can see a very many product where teeth segmentation as identification of teeth is so important. It's a basic start, but that's where you start training an algorithm. So here you can see also the caries detection. For example, the mesial of tooth number 16, then other teeth has a mesial or distal caries, and identifying the teeth like which tooth that is. So this is a Velmeni AI software for teeth segmentation. This is another image which shows about caries detection on the mesial of this distal of this premolar, and it's well demarcated. Also, the bone loss, as you can see on the Velmeni software, is, for example, here it says, I'm not sure you can see the screen well, but 0.76 millimeter on the mesial side of this molar. So it shows that how accurate this bone loss detection and caries segmentation is. So that's our focus to help more and more general dentists to identify, not miss this finding, and have a better prognosis of any treatment or any procedure a practitioner might do. Other example is this is a very good slide which shows about how AI examines a single tooth. So basically, an image of this single tooth. As you can see, this is a molar tooth. AI focuses on anatomical landmarks such as this two landmarks. There's a CEJ to the bone level. Then final result outcome will show about exactly pinpointing those cement enamel junction and that bone loss level. And then clinical result will be about radiographic bone loss of that tooth with how many millimeters mesial and distal. So really it would change the how we do a treatment planning on the patients. This is another image of the teeth segmentation, also caries detection, which is basically bread and butter dentistry. You have to detect caries and help patient out before it progresses to a major problem. So this is a great accuracy to identification of teeth and also caries. If we go more deeper into it, you can see actually canal segmentation as well, and also the crown, the enamel, dentin, and pulp all were segmented separately. And also you can see that the green color which you see is about exact determination of how much caries is inside the dentin. And also you can see the enamel as well. So this is another example of the applications of AI in real time. Perio and endodontist mainly focuses on periodontal bone loss and in apical pathology, and AI is helping to understand these patterns and also identification of pathologies with a poor prognosis in maxilla and mandible, so the treatment plan can be changed. In endo, it is divided into three major aspects: detection, pre-treatment, and prediction. So in detection will be periapical pathology, crown and root fracture, apical foramen determination, and also checking the quality of root canal filling. In pre-treatment is working length determination, which is so crucial for any endodontic treatment, and also root and canal system morphology, the degree of curvature, that also determines the success rate. And AI can do all this. Also, the next step is prediction, about predicting outcome of the endodontic retreatment and any stem cell therapy if there is a viability of it or not. This is another image about diagnosis of a periodontal bone loss, and also the crown you can see on the screen by Velmeni AI software. In ortho, as I said, that orthodontists are mainly using 2D imaging, but now use of cone beam CT has increased. So their major focus is localization of landmarks to improve the efficacy of the orthodontic treatment plan. And AI can automatically do the localization of landmark and having those landmark on cephalogram. Also, with the use of CBCT, It's a more versatile approach. So because of the automated system, we can overcome the shortcomings in the orthodontic treatment plan by measuring those cephalometric landmarks and creating a new treatment plan for patients. In ortho, again, it's clinical assistant. AI can do the patient management, voice recognition, database building. Ortho diagnosis can do data collection, cephalometric photographic measurement, growth estimation of the jaws, facial analysis. And again, in the ortho treatment would be treatment planning, simulation that after the ortho treatment, how the patient will look like, and then appliance production as well. So these are the major areas for AI used in orthodontics. Some of the papers that were published in for cephalometric analysis of deep learning, and as you can see, that success of classification is almost 88.43%, which is pretty significant to start with. These are other papers which focus on comparison with AI with human observer of cervical maturation rate. And then you would see that almost the success rate is more than 70% in all the articles. These are other good papers published in cervical vertebra maturation. Skeletal classification based on AI. Again, if you see area under curve is greater than 95%. I won't say that even if it says above 95% is the accuracy, but still it's even if it's not, even if it's 80%, it's a good start that we can improve on and help patients with this kind of skeletal classification and actually changing the treatment plan accordingly. This is one of the beautiful image which I use in my presentation as well, that airway analysis. So in your practices, in medical practice too, you mostly come across obstructive sleep apnea patients, constricted airway. And this is after training for with thousands and thousands of images, we created an algorithm, and you can see the outcome or byproduct of this whole Velmeni AI software detecting the airway so accurately, and also pinpointing some of the, as I'm pointing at right now, the red zone, pointing out the airway constriction in that particular region, and also it will tell you exact volume, how much airway has narrowed in that area. So we can help a sleep apnea specialist who can help patient with some kind of appliance, but that airway analysis can be easily do by the Velmeni software.
Dr. Rohan, I have to remind you that we're running over time. We've got Dr. Rohan. Can you hear me? Dr. Rohan.
Almost accuracy is above 90%.
Dr. Rohan, can you hear me?
Divided into different areas, but these are some of the beautiful images for the airway analysis.
Dr. Rohan.
Implant dentistry, tracing and marking mandibular nerve canal is important aspect for implant placement. I'm also a legal expert for most of the malpractice cases, and I would say most of the time, I would say 60% of the time, the malpractice cases happen based on the nerve injury. So it is so important in dentistry to mark and trace this mandibular canal nerve. And other aspect is bone mineral density, which is a crucial part of implant planning. If it has a good mineral density, considered as potential area of AI applications, and it would increase the success rate of patients with placing an implant in that specific area. So these two factors are relevant to BMD, high bone turnover rate, and high risk of osteoporotic fracture is pretty common. So maybe application in bone mineral density of AI would change outcome. Also, patient with bisphosphonate therapy has a great risk of osteonecrosis. So AI can help with those kind of patients as well in case of implant treatment planning. This is another image from Velmeni AI software on a periapical radiograph, and as you can see, the clear demarcation of implant on the periapical radiograph. It's a very beautiful image, and you can see how accurately it's demarcating the implant. At the same time, it would help if there is implant failure. So if there is a significant bone loss associated with that implant, Velmeni software can detect it, combining that periodontal bone loss and implant detection, and it can give you actual outcome, like what could be the prognosis of this implant in long term. So do we need to really remove that implant, or come up with the any other option? Option? You able to see my screen? I think it got disconnected. Can you see my screen?
Yeah, Rohan, we can.
Yeah. Okay, I think it got disconnected before. One second. This is another automatic segmentation of bite-wing radiograph. Bite-wing is basically a radiograph which has only crown and portion of the root in the radiograph, showing the root canal, treated tooth, restoration, also the detection of caries and a bone loss. So, and also on the side, on the right side, you would see the teeth numbering. If you click on each tooth, it would show you the exact bone level, how much is a mesial or distal, what is the root canal, treatment is it successful or not, is it filling accurate or not, does it need to be replaced on, if there is a marginal leakage. So these are some of the important dental findings which would be seen in this AI software. Implant planning. This is a good paper on cone beam CT on implant treatment planning. What we focused on showing the really accuracy of this implant treatment planning on cone beam CT. So I just wanted to briefly show this paper to you. Other paper in clinical medicine was about peri-implant bone loss measurement using a region-based CNN in periapical radiograph. And as you can see, the beautiful image here of the accuracy of the bone loss. This is a fantastic work by artificial intelligence algorithms. Other area of applications of AI, detection of crown and restorations. As you can see, the well-demarcated line of restoration on a crown, occlusal surface of a molar and a premolar. It really helps to understand if there is a marginal leakage in this restoration or a crown, which leads to an extension of the caries to the root, and might change the treatment plan as well. So this is another application of crown and restoration by Velmeni software. Let's talk about AI in oral surgery. Third molar is the most important thing in oral surgery. It gets impacted in jaws, and then oral surgery will be able to help remove those, extract those third molars. AI is predicting those, is very useful to predicting those third molar development in the right direction or not, and also classification of those third molar development and types based on the treatment plan. So AI can help the treatment plan also tell the practitioner that is this impacted tooth gonna develop in the right direction or not. And I want to show you the beautiful image of the sinus application. So as you can see here.
Dr. Rohan, I have to interrupt you here because we're seriously over time. We thank you for your presentation and look forward to welcoming you in person here in Egypt. Thank you very much for your kind presentation, and thank you for being here with us today. And greetings to everyone at Velmeni, and see you soon. Thank you very much, Dr. Rohan. Thank you.
Thank you, Dr. Ahmed, for having us. Thank you, Rohan. Thanks for the presentation.
Thank you very much, Mini, and look forward to seeing you soon. Thank you. Bye. Thank you. Thank you. Now we've come to the end of this symposium, and Barak